What is matrix size? Matrix size equals number of pixels in the image grid. Matrix size equals number of rows times number of columns. For example, a 256 times 256 matrix means the image is made of 256 rows and 256 columns equals 65,536 pixels. A 512 times 512 matrix equals 262,144 pixels. Much more detail. Effects of matrix size on image quality. 1. Spatial resolution, sharpness, upward arrow. A larger matrix means smaller pixel size, assuming field of view is constant, which leads to sharper, more detailed images. You can see finer structures, great for detecting small lesions or fine anatomical detail. 2. Pixel size, downward arrow. Pixel size equals FOV/matrix size. So, if FOV stays the same, increasing matrix size reduces pixel size, increasing detail. 3. Signal to noise ratio, SNR, downward arrow. Increasing matrix size spreads the same signal over more pixels, so each pixel receives less signal, reducing SNR. Trade-off, better detail but more noise, grainier image and less compensated by other factors like longer scan time. Scan time, upward arrow. In MRI, higher matrix size often means more phase encoding steps, so scan time can increase unless you use parallel imaging or other acceleration techniques. 5. File size, upward arrow. Larger matrix equals more data equals bigger files and more storage needed. Clinical scenario. A patient with known metastatic sarcoma is being evaluated for suspected brain metastases. The radiologist is using a T1 weighted post-contrast MRI sequence. Detect a tiny 4 mm enhancing lesion in the right parietal lobe. By matrix size example, 512 times 512, pixel size, assuming FOV equals 24 cm 240 mm / 512 0.47 mm. Images, higher spatial resolution. Tiny enhancing lesion is clearly seen, well delineated from surrounding tissue. Better margin evaluation for possible edema or adjacent vessels. Disadvantages, slightly lower SNR, might be compensated by more averages or 3D sequences. Longer scan time or need for parallel imaging. Low matrix size example, 256 times 256, pixel size, 240 mm / 256 0.94 mm. Disadvantages, lower spatial resolution. The 4 mm lesion might occupy only 3 to 4 pixels. Rightward arrow appears blurred or even missed. Harder to differentiate from vessels or artifacts. Advantages, better SNR, each pixel collects more signal. Faster scan time. With 512 times 512, the lesion is confidently identified and measured. With 256 times 256, it might be subtle or missed, especially if there's motion or less contrast. World tip: MRI/CT radiologists often choose larger matrix sizes for brain, inner ear, spine, small joints. Thin slice imaging for oncology follow-up. Might choose smaller matrix sizes for time-sensitive scans, example unstable patients, large field of view studies, example whole body MRI, areas where spatial detail is less critical. Clinical scenario: a 58-year-old smoker undergoing a low-dose chest CT for lung cancer screening. You're looking for small pulmonary nodules, particularly sub-centimeter ones. CT matrix size and voxel size. CT scanners typically use a 512 times 512 matrix, but the spatial resolution also depends on field of view, FOV, slice thickness, reconstruction kernel. So let's compare two scenarios using the same scanner and slice thickness, but different FOVs, affecting pixel size. Small FOV, 25 centimeters, with 512 times 512 matrix. Pixel size, 250 mm / 512 0.49 mm. Advantages, better spatial resolution. A 4 mm solid nodule is clearly outlined with clean edges, subtle spiculations or calcifications visible. Used in high-resolution lung CT, mediastinal evaluation, Targeted reconstructions. Large FOV, 50 cm, with 512 x 512 matrix pixel size, 500 mm / 512 0.98 mm. Disadvantages: the same 4 mm nodule may appear blurred, fewer pixels represented, speculations may not be visible, rightward arrow harder to characterize as suspicious, may mimic vessel or artifact. Outcome: small FOV plus 512 matrix rightward arrow lesion is well visualized, potentially flagged for follow-up. Large FOV plus same matrix rightward arrow nodule is less distinct, may be missed or downgraded in concern. Real-world tip: in CT, the matrix is often fixed at 512 x 512, so field of view becomes the key factor. You can improve resolution by reducing FOV for target organs using thin slices, example 1 mm, applying sharper kernels, example lung kernel vs soft tissue. SNR is a measure used in science, engineering, and data analysis to compare the level of a desired signal to the level of background noise. It's a way of expressing how much useful information is present compared to the interference or randomness that could obscure it. In simple terms, signal equals the actual meaningful data or information you want. Noise equals the unwanted random data or interference that makes it harder to see or interpret the signal. SNR equals power of signal, power of noise, often expressed in decibels, dB, using the formula SNR equals 10 log 10, signal noise, SNR dB equals 10 log 10, P noise, P signal. Like MRI or CT scans, high SNR means the image clearly shows the anatomy or pathology. Low SNR means the image is grainy or unclear due to too much noise. Audio: in a music recording, high SNR means the vocals and instruments are clear, with minimal background hiss or static. Telecommunications: high SNR in a phone call means the voice is clear and not drowned out by static or background noise. Key takeaway: the higher the SNR, the clearer and more reliable the signal is. Low SNR equals harder to detect or interpret the signal correctly.